probably heard of the term hospice, but you may not really get it and know exactly what hospice is all about, what kind of care is really provided there, because it is such an asset to our community. And Anna Jean O'Neill is head of hospice in Nashville, and it's so good to have you here to take the time to describe really what this gift of hospice is to our community and the people it serves.
Absolutely, and thank you for having us.
Sure.
So Alive Hospice, we are a 501c3 not-for-profit, and we are actually the third oldest in the United States and the first in Tennessee. And so our founders started with that same intellectual curiosity of how do we do end of life better? Instead of looking at taking care of a dying patient, how do we completely rechange that focus to become taking care of a living person? And that is what we still do today. Hospice originally started in the 11th century, if you can believe that.
No, I had no idea.
In the 11th century, and if you think about it, we all die.
Mm-hmm.
It's not something that people want to accept. They want to, kind of say it's not going to happen to me, but it's a natural part of life. And so what hospice does specifically, frankly, is it restores hope, and it's about healing when cure is no longer an option. And it's about emotional healing, it's about spiritual healing, about connecting with a family for healing, and then taking care of the body as it begins to fail, so that no one will have pain and that everyone can pass away with peace, comfort, and dignity.
Mm-hmm. Mm-hmm. I think most people think about going to hospice. Hospice can be provided in a number of ways.
Mm-hmm.
In the home, where most people, I think, would prefer
Mm-hmm.
to enjoy their final days, weeks, months, whatever it may be. It can also be provided in a hospital setting, correct? Or in the facility here on Charlotte Avenue.
Absolutely. Most folks want to be at home, and so we absolutely honor that. I mean, everything about hospice truly is person-centered, and it's what are their values, where do they want to be, and how can we best care for them. So over 90% of our patient population at Alive Hospice is in their homes, or whatever they call home. It could be a nursing home, it could be in their homes themselves, but if someone either can't be at home or doesn't want to be at home and wants a different location in order to pass away, we have a facility on Patterson, which is just right here in downtown Nashville. We have another 15-bed inpatient unit at the Skyline Madison campus, and then we're opening a brand new facility in Murfreesboro that will open in June of 2017. And so some people don't have a home to go to and don't have someone that can care for them, and so the residents in our facilities take care of that. And then unfortunately, there are times where a symptom burden is so great that the only other option would be in a hospital. Well, we don't want folks to have to go back to a hospital, and we can provide that same level of intensive care in one of our buildings in a dedicated hospice environment.
Who is hospice specifically for? I mean, is it just for people of a certain age, a certain diagnosis?
It is for all ages. Hospice and really end of life knows no socioeconomic or age boundaries. So we in fact have a perinatal hospice program, and that's for moms with babies that won't survive delivery, or if they do, it's only for a very short period of time. We have a dedicated pediatric hospice team. Children aren't supposed to die, but sometimes they do, and we can't control that outcome, but we certainly can have an impact on that journey. And then we take care of all ages and all diagnoses and all diseases in between.
I think it takes an incredible person to be a hospice nurse. I've been around them in different situations with friends who've been in hospice, and they just have such compassion, I think.
One of our board chair, it's funny when he talks about it, because these are just people of a different breed.
They really are, I think, in a good way.
It is in a good way, and we are a clinical specialty the same way, whether it's emergency care or cardiology or neurosurgery. Hospice and taking care of folks at the end of life is a certified clinical specialty, from physicians to nurses to social workers and our hospice aides. And so, but it centers around living, and it centers around really bringing the most of life out of someone until their very last breath. And so it's a privilege. It truly is a privilege to be allowed to be in this space with our families.
Beautifully said. I think some people think about hospice stereotypically with certain things, like with someone's given up. Can you expand on that?
It makes me crazy when somebody says, well, there's nothing else we can do, so we've called hospice, and just have that downtrodden,
Like defeated.
that defeated piece. And I'm not going to tell you it's easy. I'm going to tell you this is a really hard space to be in. So I don't want to make it more light than what it truly is emotionally when you're at that point. But there's always something else that can be done. Even though cure is no longer an option for the disease, you rechange your focus in life, and it really is what's important to you. How do you want to spend your life? I mean, the song that Tim Nichols wrote, that Tim McGraw recorded, "Live Like You Were Dying." Think about that. What's important to you? And Ira Byock, who's a kind of a founder of palliative care in so many ways, coined really great hospice and palliative care creates the space to allow someone to be able to say these 5 things. Please forgive me. I forgive you. Thank you. I love you. And goodbye. And think about it. If you're given an opportunity at the end of your life to be able to have that healing with friends and family and loved ones, emotionally and spiritually, it's a precious space to be in. And it truly is an incredible gift. And so hospice does that. It allows that healing for a family member that's passing away. And equally important, it creates the space for loved ones to be able to have a comfort with the end of their loved one's life and really begin to help them on their own grief journey to their own recovery.
I was going to say, and with that experience and those things said, it probably helps them in letting go in case there's something holding them back towards the end. If people want to learn more about hospice, where do they go? How do they get that information?
Well, we would love for folks to come to our website at www.alivehospice.org or call us. Call us directly at 615-327-1085. And then the 4th Friday of every month at our Patterson Street location, we do a community lunch and learn. It's free lunch. You have to sit through an educational session, but it's a great way to learn in person too about who we are and what we do.
Jean, thank you, and also correcting me, not Charlotte, on Patterson. Thank you so much for a really powerful presentation on hospice.
Well, thank you very much for having us.
Okay, we'll be right back. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.